with the patients that they are expecting too much from the doctor?
The main reason for this unacceptable situation which has arisen in this country is predominantly because of shortage of doctors. If 1,000 patients are chasing one doctor, naturally there are few doctors may behave in an odd manner. We are extremely short of doctors. India is short of 3 million doctors. We are extremely short of specialists. There are big cities in India where there are hardly some 5-10 cardiologists or nephrologists. So unless we address the shortage problem, unless we produce more number of medical specialists, this kind of incidents cannot be controlled.
So your recipe for success in healthcare is laudable. On a larger platform, how do you suggest we can transform the Indian scenario in healthcare? It's a little bit so many issues. I mean, it's very difficult to catalog all of them. What were the main thing that you would like to address as of today?
You always hear of budgetary allocation not sufficient for healthcare. I can tell you that even if we increase the budgetary allocation by 3 times or 10 times, Indians will never have the healthcare, predominantly because we are extremely short of medical specialists. We need policy changes. We need just one policy change which will equalize the number of post-graduation and undergraduation seats in the medical colleges. United States has 19,000 undergraduation seats in medical colleges. They have 32,000 post-graduation seats. Double the number of undergraduate seats is the post-graduation seats. India has 52,000 undergraduation seats in medical colleges. There are only 14,000 post-graduation seats. So young doctors after graduating spend 3 years to 5 years waiting for a PG seat by attending all the coaching classes. This is the main reason why we have a crisis in this country. Unless we equalize the UG and PG seats in medical colleges, this country will not have better health care. Maternal mortality, infant mortality will not come down. No matter how much money you spend, you are just wasting your money.
So the skill gap is there. The skilling.
There is a huge gap. See, the medical service is a very regulated industry. When your computer is down, anybody can come and repair it. When your car breaks down, anybody can repair it. When you have a health problem, only doctors can touch you. Nobody else can touch you. I am a heart surgeon. If I do a cesarean section, I lose my license. So it's a regulated industry. Unless you produce that many medical specialists, how can people have access to health care? And we don't allow foreign doctors. We don't allow American or British doctors to come and practice. The law says the doctor has to be trained and born in this country to be practicing here. And those who graduate and become doctors, we don't allow them to become specialists.
And how well regulated is the healthcare industry?
Healthcare is regulated in a very distorted manner, so that there is always a shortage. And when there is a shortage, it's a license Raj in medical education. So obviously when there is a shortage, lot of other issues come up, which is benefiting few people. So the status quo continues and the poor people continue to suffer and they die. And it goes on.
You see, the most important thing is affordability or the cost cutting in hospitals is a big challenge. Now, what should hospitals do about it? If you have addressed it very nicely.
Unless we increase the number of beds, unless we have more medical specialists, cost of healthcare will not come down. In US, the salary component is 65 to 70%. In India, it's around over 25-30%. It's a matter of time before it reaches 50-60%. Unless we produce more number of doctors, your effort to reduce the cost and make it accessible to people will not happen unless we have more number of medical specialists.
Now, role of telemedicine that can play in cutting down the cost?
It will help definitely to quite a large extent. More than the cost, access. People in remote locations will be able to access healthcare today with telemedicine. It's a very, very important tool, and it is a matter of time before everyone will access healthcare on their mobile phone, sitting in their bedroom.
It's a matter of time.
It's a matter of time. It will happen within 10 years' time.
And technology is used to enhance the patient care in a big way. It is happening. Now, how will this hospital implement them? And besides, simultaneously we are having the affordabilities there.
See, the next big thing in healthcare is not going to be a magic pill or a fastest scanner or a new operation. It is going to be information technology which will dramatically change the way we deliver healthcare. Whatever online retail has done for retail industry is nothing compared to what information technology can do to healthcare industry. Everything what we do in healthcare will be redefined, and that will be redefined by IT. And that will happen in India.
The number of cardiac surgeries done here are much larger than national average. How do you manage and how do you scale this up?
Our whole approach is to reduce the cost of heart surgery. You can't reduce the cost of heart operation if you are doing 2 or 3 heart surgeries in a day. So we built this heart hospital with the idea of doing 60 major heart surgeries in a day. That is our target. So when you do large number of heart operations, cost goes down.
And finally, your expansion plans, your roadmap of providing affordability in other facilities.
We are a multi-specialty hospital chain, and we have hospitals in 30 locations, over 30 locations. We have close to 7,000 beds.
Overseas also.
Yeah, we have a health city in Cayman Island. Yeah, so we have great plans for Africa, India. We believe that the only way to reduce the cost is by having more number of beds, more number of patients coming, and it's fascinating. It's happening.
So as a health minister, what exactly one or two things you like to see as a policy change that you think that will bring a drastic change?
First thing is equalizing UG and post-graduation seats in medical colleges. Then starting diploma courses in all the government hospitals, because most government hospitals have few thousand vacancies in having a shortage of anesthetists, radiologists, physicians. So if they start a diploma course, they can have access to those training programs. So within 2 years, all the MBBS doctors working for the government will become anesthetists, radiologists, or the physicians. It can happen in very short duration of time without much investment. Then in the rural part of the country, Ayush doctors should be allowed to practice and treat patients. That is the only way, because MBBS doctors don't want to go to villages. I have interviewed few thousand young MBBS doctors. I haven't come across a single doctor medical student who will tell me, looking at my eyes, saying that he wants to remain as an MBBS doctor and want to work in village. Every medical student today wants to become a specialist. So you want decent healthcare in rural India, create alternative healthcare workforce. And there are over 7 lakh Ayush doctors. They are willing to do that.
So what will be the way out for this?
We just need a policy changes all over the world. It is the nurse practitioners or physician assistants who offer primary health care in rural part of the country. And how can we be an exception? We have no choice. Because they are the poor people and rural villagers, it doesn't bother us. We think it's okay to continue. But who is suffering? They are the ones who are suffering. It doesn't bother us.
So what do you have to say about the PPP model? Well, right now there was news that the government is very keen to have the screening centers in each and every district of India. And the players like GE, Siemens, they are also equally willing that yes, we want to come up. So where is the disconnect? What can be done about this?
You may put up a CT scan in every district headquarters hospital, but where are the radiologists? India requires 2 lakh India requires 2 lakh radiologists. We only have some 12,000 or 15,000 radiologists. You may put all the machines, but there has to be an expert who can interpret it. So the machine is useless without the radiologist.